Hello, my name is Mark Iskowitz. I'm Executive Editor at MM&M, and I want to welcome you all to the second installment of the MM&M Transforming Healthcare webcast series, where we take a deeper dive on themes that were discussed at this month's Transforming Healthcare conference. This post-event webcast is titled Be the Brand Your Patients Want You to Be, The Power of Intelligent Mobile Adherence Solutions, and it's sponsored by EngagedMedia. Just a few words of intro before I introduce today's speaker. According to recent Epsilon research, 80% of consumers are more likely to do business with a company if it offers a personalized experience. Can life science companies also offer this type of connection with their audiences despite the distinctly different pain points that patients have navigating the healthcare system? They can and they are. Today, brands are using innovative approaches to engage patients through the communication channel that best supports real-time communications, which I think we can all agree is mobile. Done well, these data-driven strategies have proven to help clear some of the most common barriers to adherence and offer real value to healthcare consumers, thereby building brand loyalty for manufacturers. Joining me to lead this session is Sooudi, General Manager of EngagedMedia, a division of Aptus Health, and he is going to explain how to leverage the power and ubiquity of mobile to engage patients in branded interactions, provide real-world examples of how intelligent mobile messaging drives patient behavior, and help you understand the potential of these patient engagements to deliver insights that support improved doctor-patient relationships. And just a few things to know about Haas. He's responsible for EngagedMedia and leads the company's sales and product development efforts. For the last decade, Haas has been working within healthcare to develop digital patient engagement methodologies and technologies, and he's worked with over 60 major prescription brands over the years and brings a wealth of knowledge and experience spanning multiple industries with principal focus on pharma marketing, mobile media, and innovative technology environments. Okay, so Haas is going to speak for the next 20-25 minutes, after which I'll come back on the line for a 5 to 10 minute Q&A session. Okay, I'll now turn things over to you, Haas.
Great. Thank you, Mark. This is Sooudi with EngagedMedia, and I'm happy to be speaking to you today about what we view as not only the normative way to communicate with patients, but also the idea that mobile isn't just simply another channel, but really the primary method of engagement, not just for pharma brands, but for consumers overall, to have a relationship with an entity or a brand or a company or anybody. So part of what we like to talk about before we get into the meat of the subject is the fact that in our current state, most people understand and realize that mobile is so ubiquitous that it's a part of our everyday lives. No longer are we quoting stats saying, hey, look, 86% of people who are doing this are using it via mobile, or these people are using mobile with this many minutes. We can, of course, and Pew Research always has a number of statistics that are 3 or 4 years old. But at this point, we can say comfortably that most people are using mobile phones. They have mobile phones. More than 96% of the country has it. But what's poignant about that is that 46% of Americans right now say that they couldn't live without their mobile phones. Now, that's a different level of engagement. We're not talking about people using mobile now as a preferred method, but really where it's so ingrained in their everyday lives that mobile is a part of their typical function, typical interaction with individuals and brands and so forth. So without a mobile strategy, without engaging in some method of dynamic and personalized messaging to patients or just general consumers, you're just missing out on how patients or consumers prefer to interact today. So that being said, we've also been working with a number of our brands over the years to help get them to this point where not only are they utilizing mobile, but doing so in a way that's helpful for patients. And so when we talk about mobile, it's a pretty vague concept. Mobile means pretty much anything that is on a mobile device. That's mobile phones, tablets, or anything that typically has a connection to the internet or a mobile service provider. But specifically, in the types of programs that and campaigns that we've launched with our clients and partners, mobile means more than just a mobile function. It's also the mode through which people prefer to communicate. And what we found is that text message is not only highly efficient, but also the preferred method of engagement for consumers and patients today. Now, as an example of how prevalent text messaging and SMS usage is, I think the current rates right now, and we have a number of sources on this, say that about 88% of what people use their mobile phones for is for text messaging. And making phone calls doesn't even crack the top 10. So that tells you not only how people are feeling about mobile, but how they're using it. And in addition to that, 90% of people read an SMS message within 3 minutes of receiving a text. So, we'll use text message and SMS concurrently, although they're, people tend to see them slightly differently. But whether it's text message via a WhatsApp interaction or Facebook Messenger or a direct message, or it's true SMS interaction via mobile, the idea is the same, where not only is it the preferred method, but also it's actionable. So when people receive a text message, they're acting on it or reading it almost immediately. And that trumps virtually every other method of communication today. So given the ubiquity of mobile phone usage, most brands are looking for ways to interact with patients and consumers in a way that makes sense to them, not just because they're using mobile, but also where there's some sort of engagement. Now, too often, brands, companies are just utilizing mobile as a channel to say, look, we've got something mobile. Great. We've got a mobile app. We've got some mobile function. But most often, especially for those that we've not worked with and those that are relatively new to mobile engagement, specifically with patients and consumers, the idea that interaction somehow equates to engagement is so prevalent that most people can't distinguish the two. And when I say people, I'm referring to mobile marketers, especially in pharma, where the idea that there's a transaction to be had or made, or that's the goal, and that the interaction should be based solely on that transaction is a problematic one. And that's at the core of how we do things at EngagedMedia, and why we are able to drive tremendous value through the relationships with our patients, because what we focus on is actually engaging patients. And what I mean by engagement versus interaction, we're looking at ways to deliver value to patients first. So that's our core pillar, is how can we deliver value to a patient before we're getting anything of value back from them, before we're looking to have some sort of transaction with them. We're looking for ways to say, how can we make their lives easier in the way that they're already living their lives? So via mobile, this tends to look like how can we streamline a process, whether it's at the pharmacy or getting a prescription or refilling a prescription or getting a new script, whatever that might be. We're looking for ways to make a patient's life easier using the methods that they're already using. And as we said, mobile is the biggest part of that. And so when a brand or a campaign strives to be mobile first, which is great, I'm not dogging that. It's clearly something that should be a goal for virtually any presence these days. But once mobile connection or communication method is established, the engagement piece that stems from that comes from value. And so we think that looking for ways to utilize the intimate access that mobile provides a brand to its patients or its consumers or participants is the only way to not only maintain this relationship with patients, but also to derive long-term value. And so it's true for pharma brands alike, not just retail brands or what many people think of, whether it's retail or any other industry that utilizes mobile. These are the types of methods that we want to say should come first before a fill, before adherence rates, before refill rates, that we should look for ways to provide value to patients. And I think without that, there's a risk of being intrusive or annoying in many cases, where the focus might be on just the interaction, just the transaction. And so that's why we believe that we see very high opt-out rates in most general consumer programs. So in mobile, about a 50 to 75% opt-out rate is relatively standard. That's decent. That makes sense. In healthcare, it's a lot better. On average, mobile campaigns, not ours, but average mobile campaigns see about a 25 to 45% opt-out rate. And that's pretty good too. But in our programs, in our campaigns, in engaged patient programs that we have for pharma brands, our opt-out rate on average for all the brands we worked with over the last 10 years or so, our average opt-out rate is less than 5%. Now, some are much lower and some are slightly higher. But the indicator is that because we're delivering value, fewer and fewer patients are opting out. And as we move forward, that is one of the key metrics that we can look to say, here is where we're clearly adding value to a patient interaction. And while they'll stay in this campaign, and where we can then direct our clients to say, here's the next step, here's the next frontier for us to be able to offer something of greater value to that patient, to not only stay on therapy, but also help them live a healthier life in the way that they want or prefer to do so. Now, all that being said, obviously we've talked about mobile being so prevalent. Interaction oftentimes is focused on, but engagement is not. So as we talked about mobile being the way that patients prefer to engage, it's the language of patients. It's the language of consumers now. Having engaged millions of patients at this point, we have an idea of what works and what doesn't. Not only, obviously, the mode and the mean through which patients interact, but also the content and when patients prefer to have some type of information, when they want to use their mobile phones during their healthcare journey, and what they might want to know and utilize. So what we also provide, besides just a mobile engagement, is also a dynamic and individual interaction for each patient. So within our programs, within EngagedMedia mobile campaigns, patients enroll and utilize whichever means through which they prefer to enroll. So if it's text message, if it's email, whatever it is, digital wallet, we offer all of these methods. But what is consistent across every single mode or interaction is the fact that we're providing a personalized interaction for each patient. And we do this based on the information that we receive, that they provide consent and authorization for us to view from their pharmacy claim. So to explain that, when patients enroll in our programs, we are typically providing them some sort of copay offset or discount. And they're not required to do much else other than say, yes, I agree to the terms and conditions. Once they do that, they can use this discount at the pharmacy. And once they use it at the pharmacy, we see that in real time. We see when a patient goes to the pharmacy and uses their coupon. We see what prescription they've dropped off. We know what brand it is. We know the strength. We know the quantity. We know who the prescriber is. We know what pharmacy it's at. We know how many refills they have available. We have up to 408 fields of information on this patient immediately. So from the moment that they fill at the pharmacy. And we use that information to dynamically interact with each patient. So we know that John Smith just filled at the Walgreens on Main Street, that we're going to message John Smith within typically about 90 seconds of that fill being processed at the pharmacy. And keep in mind, 95% of the time, this is before John Smith has come back to the pharmacy to pay for it, or if the script is called in before he's even arrived at the pharmacy to pay for it. So when we see this information, we're arming that patient with that type of information, saying, hey, John Smith, you just filled your XYZ brand medication. Your copay is XYZ. Your out-of-pocket is this. Whatever the case might be. Your insurance covered this much. Here's how much you're going to owe. You have a few refills remaining. We'll let you know when it's time for you to refill. Things like that. And so that's starting the intelligent process and engagement for our patients, where they understand what's happening and they're getting this intelligent messaging. And it's unique to each person. So John Smith doesn't get the same thing as Jane Doe. Not only are obviously their names are different, but their situations are different. Their prescriptions might be different. Their prescriber is different. Their pharmacy is different. So all these things are obviously uniquely suited to each individual, but also based on their unique prescription interaction. So whatever might happen at the pharmacy, if, for example, the brand script is subsequently reversed or canceled in the pharmacy for any reason, like the patient saying, hey, this is the cost is too high for me, or the pharmacist decides in most states that they're going to substitute the brand script for a generic. The patient may or may not know this. So we're also providing messaging in real time based on these point-of-sale events at the pharmacy. And that's how we first provide this heightened ability for patients to understand what's going on by using their data and giving it back to them. So the initial value is obviously, hey, look, we're using mobile in a way that makes sense to you and providing you some convenience. The second way is then saying, here's some information in a timely manner where you might be able to actually do something about it, or it would be helpful to you. And then beyond that, we're also providing additional services like refill ordering that's based on their particular script. So we know when you might be coming due for a refill, and we'll tell that patient, John Smith again, hey, it's been 26 days since you last filled. Reply yes, and we'll order your script for you at the Walgreens that you visited on Main Street. So that's the type of interaction and conveniences we're trying to provide to patients and to bring value first. And what we found, though, is that once we've provided value, once we're offering this engagement to patients, that it's making their life easier, that they're far more likely, each patient is far more likely to stay on that therapy. They're far more adherent when we make it easy for them to be adherent. Now, this is logical. It makes sense. Everyone says, well thanks, Hoss. That's brilliant. Great. I didn't know that. Well, that you may say that, but in practice, in reality, how to do that is actually quite complicated. And part of it is because we've done a lot of it for 10 years where we knew what doesn't work. We didn't just come out of the gate saying we know how to do everything perfectly and we'll make everyone's lives easier and it's going to be wonderful. We messed up a lot. We did that in the early years. And our clients not only prefer to ask us on how they might want to go about a new campaign, but also rely on us to provide a lot of not just anecdotal evidence, but also the overall result of our experience, saying in this situation, in this particular situation, in that situation, because they're all different, what we may or may not want to do, given the fact that we've already stepped in many of these potholes before. So we're able to achieve great ROIs, measurable lifts, because we know exactly which patients are filling. We know exactly how many times they're filling. We know how often they're getting a new prescription. We know this information, obviously, because they're filling at the pharmacy. We get that pharmacy claim information. But what makes that so easy for us to then measure is the fact that we know on a patient level, and most of our clients, the brands and manufacturers, don't have that insight. They don't know, and they're, from HIPAA standpoint, they're not allowed to. But as a third party, we can do that for them and then provide not only a level of service to patients and consumers that's helpful for them, but also provide back to our clients to say, here's what's happening with these individual patients, and contrast, compare. We can also do A/B testing, ABCDE testing if you wanted, from different promotional means, DTC, non-DTC, detailing through the physician, whichever ways any of our clients may want to promote these types of programs, but also measure the types of patients that go into them. And then we're looking at ways to utilize AI and ML to understand upfront which patients are more likely to be adherent or less likely to be adherent, and then target them based on how they're coming into the program, what devices they're using. We know this. We have this level of information, and we're able to utilize these insights now to say this is where you're going to want to make your next purchase from a media buy, or which direction to go for this decision. So these types of options are available to our clients, but what we're able to do is really take away pain points for individual patients when they need it, and not for those who don't need it. So our approach is designed to be dynamic for each patient, and clearing any common barriers and providing actionable information, and finally offering convenience. And all of this helps to make the patient experience a better experience, whether it's because they're healthier or it's because it's easier for them. But this results in a greater ROI, better lift for our brand scripts. And that's really only half of it, because the way that we view our success is that when a patient is healthier, when a patient is filling more often, when a patient is less encumbered by the inconveniences of a system that isn't perfect, we're trying to improve little by little how a patient might interact with a brand, how they might go about their healthcare journey. And when we provide value first, the success is the byproduct. So when we're, again, focusing on the value of providing something to the patient, the success piece is us saying, wow, this patient is a lot more adherent. Our bottom line is looking a lot better from a brand standpoint because patients are more adherent, because they're staying on therapy. So if we look at this like the end goal. If we focus our objective, our end goal on just providing value to patients, success will be there. It will happen. That's simply a byproduct of doing it the right way, and what we feel is the right way is offering value to patients first and seeing adherence, compliance, persistency as a byproduct of success in delivering that value to patients. And that's part of what we think sets us apart, because we've been doing it for quite some time, and also we're the first ones to actually do it, and again, evidenced by our patented portfolio of capabilities, but also in the fact that the clients who are with us have stayed with us for many years. We're only expanding across pharma, and it's only becoming more and more widely expected, not just used, but expected to have a mobile engagement that just doesn't provide mobile, but also provides value to a patient. And so we talked about the ubiquity of mobile. We talked about how we view what mobile should be and the approach to take to make it valuable to a patient and to achieve some of these byproducts that we call success. Now, some of the metrics that I can give you to let you know here's what we're typically seeing is on an average over the last 5 years, on average across all different types of indications and brand products, our refill rates are about 35% higher patients in our program than those who are not. And this is controlled, of course, based on whether it's the copay or they're out of pocket. All those things are taken into account. The only difference that we're measuring here is where patients are in our program receiving our engaged patient messaging or not. And those that were receiving our messaging, on average, refill 35% higher rates. They refill 74% faster, and stay on therapy 27% more days. And so that translates into kind of typical metrics that we expect, but those numbers seem pretty high. And that's because, to us, we're offering, again, value to patients even where you think you don't have an adherence problem, and there aren't many drugs out there that don't. Even on oncology, you'd be surprised, where it's not about not wanting to be adherent. It's about having access. It's about clearing barriers. It's about making life easier for them. And so when we make things easier and provide value to patients, we're seeing these types of results. And this is on average. In addition to these kind of common metrics, now the numbers may not be as common, but the metrics themselves are common. We're also able to offer two distinct capabilities that drive significant ROI for us. One is our reversal message fill rate. And to explain what a reversal is, when a brand script is filled in pharmacy, again, we see this in real time. We know what's happening at the point of sale when a patient is filling a script, usually for the first time. Oftentimes, this fill is reversed. This is measured in walk-away rates and reversal rates, whether it's because, as I mentioned earlier in the broadcast, the cost might have been too high. The physician might have, the pharmacist may decide to switch the brand to a generic. Whatever reason that the brand is reversed, or they simply forgot. Maybe the patient just didn't come fill the script. that script is going to get reversed at some point. And when that happens, we see it in real time, and we message the patient saying, here's what's happening. You may want to see your pharmacist immediately. You're not getting the brand that your doctor prescribed you or the savings you signed up for. Whatever the case might be, we let them know what's happening. And 26% of the time, on average, we get that claim to come back to the brand. We save that script. So not only is that found money, it's also starting a patient on a more healthier journey where they may or may not, for whatever reason, we don't know, they may or may not have thought that it was right for them. But we can provide some insight to say what's happening that often changes their minds about that, which is powerful. The second piece is the additional prescription fill rate. So at the end of a prescription, if your patients are lucky enough to then fulfill the entire prescription, they're entirely adherent and compliant, wonderful. Well, now what? For many chronic conditions especially, they need to get a new prescription. So we know how many refills are left on a script, and we know who the prescriber is. We not only let a patient know, hey, it might be time for you to get a new script after this fill, but also can connect them to their physician to say, hey, let's talk about if a new script is right for me, or in some cases, if regulatory allows for that brand, that we can make that call to their physician, letting them know that the patient is indeed interested in a new prescription and getting a new script. In either case, when patients hit the end of their RX in our program, because of our end-RX messaging, we see 45% of the time, for those that are eligible, a new prescription, which is another massive driver of ROI and lift for us. But what it's really doing is making things easier. That's all we're doing, is making a patient's life easier, and we do this via mobile and via services that did not exist before, and they do now. So those are just some of the basic capabilities that we offer to make a patient's life easier. But there are a number of ways that we do more than that. We have a number of modules that utilize different types of mobile messaging and mobile usage, like digital wallet, that comes with our programs, that allows us to do more. For example, RX Proximity is our capability to let patients use a digital wallet without even enrolling in an SMS program, without even enrolling in an email program or an IVR program, anything. If they just download a digital wallet, say, hey, I want a savings card. They go to the website, they download a digital wallet card. We have the capability, once they use that digital wallet card at the pharmacy to get a discount on their brand, to then drive messaging based on just that digital wallet usage. And RX Proximity is our capability to do so based on the digital wallet and where they are in relation to pharmacy. So what we will do is typically upload waypoints to that digital wallet card, where if a patient is within 500 feet of their pharmacy and they have a refill due, that a device alert will be generated saying, hey, don't forget to fill your script. Don't forget to pick up your refill for XYZ brand since you're near your pharmacy. That's an example, again, of how we're using the level of information that we have and many digital capabilities on the mobile device to again, help keep patients a little healthier, but also make their lives easier. In addition, RX Push is another method through digital wallet where we can drive push messaging in real time, dynamic to that individual, based on simply their digital wallet usage at the pharmacy. We also have RX Appeal, which is our capability to detect in real time if insurance coverage is an issue. So if there's a prior authorization or a step edit or NDC block, again, we will see that in real time. And once we see that in real time, we'll let the patient know, here's what's happening at the pharmacy. Here's what's happening with your prescription. And here's what you can do about it. We might be able to help you get the cost of your prescription covered by your insurance. It didn't cover it for XYZ reason. Here's how we can help. Reply yes, and we'll help you do this. We'll work with your physician and your pharmacist to help get this covered for you, and we'll do it fast, and we'll do it digitally. And so these are some of the ways that we offer additional services for our clients who may or may not feel that it's right for their brand. We not only service virtually any type of brand along the life cycle, but we have results that show as a testament how well we can help any brand. So whether you're a launch brand, and we have some examples here, and we've got many case studies, so if anyone's interested, please let us know. We'll be happy to send them over, blinded, of course. But to give you an idea, we have a launch brand where 89% of those patients who received a smart reminder, what we call our intelligent messaging, refill their branded medication, which is powerful. And then for mid-life cycle brand, it's not a launch brand. Maybe they don't have the promotion or the rep sales force of a launch brand, but they're still looking for improvements. Well, we've seen a 79% improvement in the abandonment rate following a transition to not just SMS, but also to an intelligent SMS program. And what we mean by that is even for brands that have been around, that have spent some money, that even have a mobile engagement, there's a difference here in what we are doing that's not just simply mobile. Our engaged patient program is not just mobile, and we can show you how. That we are providing significant lift based on how we do things, when we do it, in what manner. All these things make a difference. And so when we transitioned a program that had an SMS program to our intelligent SMS program, we saw a massive improvement in the abandonment rate, 79%. So again, these are just examples of what can happen when we believe we're doing mobile in the right way. And from that same branded program, we had a 75% redemption rate within a digital wallet utilization. So that same mid-life cycle brand, there's still a lot to gain there, even without as much promotion and engagement that brand may expect to have or had in the past. We can do a lot for those brands. And finally, for an LOE brand, we've helped flatten erosion curves, not just approaching LOE, but post-LOE. But in one case, we had a 365% increase in the monthly refills over their 4-month projected post-LOE. And so that has some real bottom line effects. So when a brand is going LOE and they feel like they don't have any other options, we can help those specific patients on that brand to stay on the branded therapy. Again, doing this the same way that we talked about throughout this broadcast, but it's an example of how we can help every type of brand in every situation. And so if I leave you with anything today, it would be a question. I'm not really here to prescribe, here's what you should do and shouldn't do. Obviously, I have my own ideas on what you should and shouldn't do. And if you're interested, come talk to us. We'd be happy to explain what we mean by that. But I think anyone listening to this should understand and think about, how are they adding value to their patients? How are they adding value to their end users? How are they adding value, period? And if you start with that and you end with that, then the other byproducts of that success are going to result in great things for you and your brand. Thank you very much.
Hey, Haas, that was great. Really great presentation. Some interesting stats there, and I see the difference between doing mobile and doing mobile right. There definitely is a distinction there. How about we take some questions here?
Sure, sounds good.
Okay, here's one. What role can and should patient data play in addressing adherence?
That's a good question. So obviously, for us, patient data is integral to everything we do. Now, can and should, are actually, although it's the same question, they're a little bit different. They can do a lot of things, and what we feel that we're showing with our method of engagement, with our engaged patient programs, is that it can be used in a way that makes sense to patients, that is enabling, that isn't just inundation, but rather enabling them to use that information in an actionable way, to arm them with information. So that, I think, is where it can and should be used. Now, just because you can, though, doesn't mean you always should. There's a wealth of information that we get and that many people listen to this broadcast, our clients, et cetera, get information on a daily basis. But should they use it is a different question. And I think the litmus test for should is really, does this provide value? And I'm going to sound like a broken record here, but does it provide value to someone if you're giving them that information? It's not that you're withholding it, and in many cases it's when you might provide it too. But it's about, to us, when, how, what are you providing? Is it going to be actionable? Is it going to be valuable? So in many cases, we often counsel our clients who say, hey, look, you've got this great relationship with all these patients. I love that. I want to send them this. I want to send them this the next day, and I want to send them this the next day. look, I know you're excited. That's great. We have to tell them. But we don't want to be annoying. We don't want to abuse this relationship that we've cultivated. Things like, hey, check this out. We're really proud of our new promotion. Look, that may be cool and fine to the brand team, but unless it's relevant to an individual patient, we'd say don't do it. And in a lot of cases, because we're able to single out certain types of patients, whether it's profiles or their location, geographically, whatever it is, we'd say, hey, look, let's make targeted messaging. We hate doing generic blast messaging because we don't think there's a lot of value in that to everybody. Some people, yes, but not everybody. So should always be looked at as should this information be used in a way that helps someone. That's the way that we think. That's the question you should ask yourself before you do use it. Just because you can doesn't mean you should. And that's when you start to bleed into those areas of where, is this abuse of my information? Do I even want this? Why do I want to receive this? Can I opt out? So, the heightened view of privacy is the correct one, especially with consumers today. But if I think brands and campaigns treat that information as a point of value, then it's going to be a lot better for both the end users, patients, consumers, and also the brand administering a program.
Great. Thanks, Haas. And it sounds like you really learned a lot over the years and how to do this right. And I think
and if I may say, Mark, it's because we did a lot of stuff wrong. It wasn't because we came out, of the gate saying we know how to do everything right. We spent a long time messing up too. And fortunately, it wasn't for our clients. It was, on our own, with our own investment, our own time, not just doing surveys, but also running test campaigns. And in the early days, we listened a lot more to our clients saying, hey, this is what we want to do. We want to give this a shot, and we let them do it. But now we fortunately have the benefit of that experience to say, here's what we've done this before. You can still do it, but we've done this before. Here's how it worked before. Here's where we think you can improve on it. And so we think that's the benefit of us having done it wrong in the past.
Absolutely, yeah, and all those learnings are now to your clients and your potential clients' benefit. So that was really helpful to life science brands, I would imagine, in considering whether and how to use mobile for their brands and campaigns, no matter what stage of the life cycle the brand is in. And that's all the time we have for today. I want to thank you, Haas, for an awesome presentation. I want to thank EngagedMedia for their support. And thank you all, everyone out there, for tuning in and listening. This is Mark Iskowitz and Haas Sooudi signing off. We'll see you next time on the MM&M Transforming Healthcare webcast series. Take care, everybody.
Thank you.